have a very deep and multifaceted relationship with the University of Queensland. Everything from supporting the amazing research they do in paediatrics, right through to the students, the enormous amount of students in all facets of health sciences that come through the hospital. What is fantastic this year is that the University of Queensland have come on as a telethon partner for the first time, so it enables us to recognise that fantastic partnership that's been in existence for many years.
Without the foundation, this research doesn't occur. They have provided the funding which has enabled us to be able to have the staff on site that are able to work with the clinical teams, to work with the families.
We are trying to optimise the dosing of antibiotics in paediatric patients. When you don't dose correctly, then you get a poor outcome for your patient. So a patient with severe infection is not going to be able to get well effectively.
The team that out here at the University of Queensland, as well as the Lady Cilento Children's Hospital, are using a skin prick testing method whereby essentially we procure a drop of blood, and that's all, just a drop of blood.
In the past, to perform these studies, we would need to collect 5 mils of blood. But now we're able to measure antibiotics in as low as 2.5 microlitres of blood. To give you some idea of that amount, it sits very happily on the tip of a pin.
This is world first research using really innovative technology, and it's something which it's great that Queensland's at the forefront of.
We've kind of lost track of what day it is sometimes. It's like sun comes up, sun goes down.
Yeah.
You know, like you just lose track of it for the days sometimes.
It's been a bit of a roller coaster with her. Yeah.
She was in the back seat, she was blue around the lips. I didn't know if she was falling asleep or in and out of consciousness because her head was dropping and her eyes were constantly opening and closing. Within a matter of minutes, basically into ED, oxygen mask, a number of fluids hooked up to her, took an x-ray of her chest, and as soon as they looked at that x-ray, they knew it was pneumonia.
It's your sister.
They had trouble diagnosing what infection she did have. It took her a long time to work out what the actual cause of the infection was. So she was on, has been on multiple antibiotics.
She's exactly the candidate for a patient that needs to have this better informed drug dosing.
Every day they'd do a blood test to try and work out where the infection was at, what medication she needed to be on. In the right direction.
Yeah, heading in the right direction. So we're getting there. Yeah, we're getting our little girl back.
Our research is going to be highly useful for patients like Alexia into the future. This is a really big step forward for improving the treatment of infections and some of the most unfortunate clinical cases that we see.
There's an enormous amount of very good research that we support, that the University of Queensland do in paediatrics, so we're delighted to have them as a telethon partner for the first time this year.
I'm gonna stand by